This is a 4-day-old female child with a large skin covered swelling at the lower back, and we did spinal ultrasound for this patient. We can see round spinal cord with a central dot like central canal, and the black area is the CSF fluid, and posteriorly we can see both lamina. So at the level of kidneys we can see that the spinal cord with the posterior elements is normal, but when we are scrolling it downwards we see that the spinal cord is not tapering, and this is the ventral thecal sac which is expanded, and the spinal cord at this level is normal, but on going further downward there is gross distension of the ventral thecal sac with the nerve roots floating, and now the posterior elements are defective, and through the spina bifida or the bony defect, the neural structures and the CSF is communicating with the subcutaneous tissue, and there is herniation of the neural structures in the subcutaneous plane. Here we see large cystic structures covered with dura or meninges with nerve roots floating inside it, and it is communicating in the subcutaneous plane through the spina bifida. We have to make note that the superficial skin is intact, and therefore it will be a case of closed spinal dysraphism. These are the sagittal images of the dorsal-lumbar spine. The central canal within the spinal cord is normal, and the spinal cord shows normal morphology. The bony elements are also normal. But in the lower part, we see that the ventral thecal sac shows expansion, and we can see the CSF fluid as the black area or the anechoic area. We see that at this level, the spinal cord or the conus medullaris should have ended, but it is not ending, so it is low-lying cord, and we see the clear communication of the neural placard with the subcutaneous soft tissue, and it is covered with skin, so it is a closed spinal dysraphism, and it is lipomylomeningocele. The sacral vertebrae are normal. We have to look for sacral anomalies also. We have to always screen the brain of such patients for associated posterior fossa anomalies, and in this patient we found small posterior fossa without any herniation. So this is a representative image from radiographics article which shows the kind of defect that we have encountered in our case. We see that the neural tissue was herniating along with the herniation of CSF fluid outside the bony spinal canal. Why? Because there was a defect in the posterior elements, and we saw that it was covered with skin and the outer layer of the skin was intact, so there was no contact of the external atmosphere with this neural placard. So this is a case of lipomylomeningocele.